Good morning, everyone, and welcome to the final QGA event presented by the 2024-2025 QGA Committee. My name is Melissa Fernandez, QGA Social Media Director, and I'm your moderator for today's online clinic. Our presenter today is none other than my sister, Priscilla Fernandez, one of our directors on the QGA Committee. You might know her as the MC at some of our events and my dance partner for many of our performances with the committee. But she has also worked in various community pharmacies over the past 15 years in Montreal and on the South Shore, providing care to patients looking to better manage their health. So as March is Pharmacy Appreciation Month in Canada, Priscilla is more than happy today to be able to give you an overview of how your local community pharmacy can help you and give you a better idea about the many services you can benefit from each day. As always, please note down any questions or comments you might have, as we will have time at the end of the presentation to discuss further. So without further delay, here's Priscilla with her Pharma Plus clinic.
Thank you very much, Melissa. I really appreciate that introduction. I am extremely happy to be able to present to you today some of the wonderful things that you can benefit from using your local community pharmacy. We're going to share the screen so you guys can see the presentation. So there's so many things that have been changing in the field of pharmacy over the recent years and over the last decade. And although I'm going to give you a lot of information for Canada, it's applicable to Quebec as well. And although every province has maybe different ideas about how to do the management of care in pharmacies, the global main message is to better help patients be able to help themselves in terms of their health. Perfect. So we'll go on to the first slide. All right. So as you probably have noticed, pharmacists are some of the most accessible healthcare professionals in Canada. If you try to get an appointment with a doctor or a specialist doctor, it could take months before you can actually see him or her. Whereas in Canada, with the pharmacies that we have in your own community, we have so many opportunities to meet with a healthcare professional that can look after your health directly, can discuss with you and give you options. And it's astounding to even think about the actual percentage when you look at it, that patients actually go see their pharmacist, as it says on the screen, 1.5 to 10 times more often than they actually see their primary care physician. So the accessibility is there. And if you think about the numbers of things that they do, they dispense and provide advice on a daily basis for over maybe 750 million prescriptions per year. So that's an awful lot and great accessibility to patients. So why do we say they're so accessible? Well, first and foremost, as you probably know, extremely convenient, close to home. There are many pharmacies in every community serving the people in different cities. And every pharmacist in these particular pharmacies have a chance to expand on their roles. They're improving healthcare. They're reducing pressure on our healthcare system, which I'm pretty certain all of us can agree is sometimes ailing in many ways. We don't really have the care that we need sometimes. It's very, very hard to get the things we need. But to have someone there, to have a team that's available to answer your questions if something comes up is really, really a positive thing. And as the world of pharmacy continues to evolve and develop, I think the pharmacies and the pharmacy teams are doing even more great things to help their patients than before. As you can see at the bottom of the screen, there's so many new things that are being implemented in pharmacies. So I'm sure you've gone before and you've asked, is there something I can do, let's say, to quit smoking? Pharmacists can help you with that. I'm sure a lot of you have gone to get a lot of your flu shots or COVID shots at the actual pharmacy. So injections and vaccinations are coming more often part of the regular services that are actually presented in pharmacies. And I'm sure sometimes you get the inconvenience of being diagnosed with a certain medical condition, something that requires ongoing care. So you need help with that management. Sometimes you need someone who knows the actual condition, knows the medication to better help you. So you have a team that's able to help you with that specific aspect. And sometimes there's an issue that involves a lot of medications to be used to be treating that type of condition. So managing medications, maybe one or two is not so bad, but sometimes people show up with 12, 20 medications. And it's very difficult when you have one with food, without food, 4 times a day, 3 times a day. It can be very confusing. So we have the services available to you to help you better manage the medication you need to take on a daily basis. And of course, part of the evolving role is new acts that pharmacists can provide to you. So being able to prescribe certain medications without you having to go see a doctor or a nurse clinician, without having to go to the ER. So minor ailments can now be treated directly with your pharmacist just by doing a consultation with them in person or on the phone. So as I mentioned earlier, pharmacists are readily available. So as you can see in the map, most Canadians live within 5 kilometers of a community pharmacy. So once again, we're highlighting that convenience and accessibility. And pharmacists work in different type of roles. We are talking today about the pharmacies in your community, but pharmacists also work in the industry in drug development, in the government. There are hospital pharmacists as well that handle a different series of medications and conditions in the hospital setting. And of course, you have pharmacists in academia, the ones who are teaching in the pharmacy schools. So they're providing all the information and they're pivotal in the role to helping pharmacists develop their skills and helping patients have better access to care. But as you can see from the percentage there, the highest percentage of pharmacists actually work in community pharmacies, the ones that are most closely available to you as a patient. So we talk about pharmacists a lot, but there's more than just pharmacists in your actual pharmacy team. There are multiple people to make your healthcare accessible to you. So I'm sure you walk into a pharmacy and of course you have the people at the front, the people who are part of the store, the cashiers, the commis, the managers, the people who are on the floor. But as you direct yourself to the lab and back, there are multiple people involved in preparing stuff for the actual pharmacy. So other than the pharmacist who might be doing a big bulk of the medical care, there is the team that is behind them the entire time. So we're talking about the pharmacy students who are in training, who can provide adequate care as well as they're learning the techniques they need to know to become pharmacists. You have certain pharmacies that have access to nurses. So the nurses can provide added care. So the nurses can be maybe nurse clinicians who can do diagnoses and do more work, or nurses that are just there for simpler things like ear cleaning, verification for strep tests, or involved in vaccinations or other things that you might need. And of course, you have the backbone of the pharmacy team that maybe they do a lot more than we realize, the pharmacy technicians, what we call in French the assistants techniques en pharmacie, or the techniciens. So there are two different roles. The techniciens are a relatively new position in Quebec right now. There's a whole series, a cohort of students that just graduated recently, and they have been trained to do even more things to better help the pharmacist in a clinical role and other techniques that are more applicable, like the vaccinations and tests that we normally do. So behind every pharmacist is a whole team. And as you can see with the numbers, there are lots of pharmacies, there are as many pharmacists, and there's a whole series of pharmacy technicians behind them doing the work that needs to help. So your pharmacy team, as I mentioned, a lot of people are contributing in different ways, and each member contributes in a certain way. So they're there to answer questions, they're there for the preparation of medications, and there's so many steps that they have to do on a daily basis. And there are so many things happening simultaneously. It's not just one task being done per day. There's so many things at the same time. It's multitasking on a daily basis. And there are so many steps, if you think about it, from receiving the prescription that you bring to the pharmacy to serving the medication to the patient at the cash, and they pay for the medication. And the steps are sometimes very elaborate, sometimes they're very easy, but there is a lot involved in being able to better help you with your care and your health. Let's try to maybe demystify the whole dispensing process. It's not complicated, but I'm sure you walk into the pharmacy and you're like, there are so many people behind the counter. Why does it take so long? What's going on back there? There is countless things involved in doing what we do on a daily basis. So let's start with following the basic, simple pathway of what happens when you bring a prescription to the pharmacy. We'll start with the first step. So a patient arrives at the counter, the drop-off counter, with a new prescription. What happens when that prescription is presented to the first person who takes it, which is the pharmacy technician? Well, first of all, a lot of thought goes into actually starting the process. First of all, the pharmacy technician is obligated to make sure, am I looking at the right file for the right patient? So the person is validating the identity on the prescription, validating the file. An update is needed, obviously, because let's say you take a prescription to a pharmacy, but the last time you've been to the pharmacy is 5 years ago, and you don't regularly get medication, and this was an exceptional case. So what are we going to ask when you show up? We need to know, are there any changes in your health? Do you go to another pharmacy? Are you taking medication regularly elsewhere? Are you using over-the-counter natural products, something that we should know about that might interact with the medication you're being prescribed? The allergies, like I said, is extremely important because from one day to the next, you could be a person with no allergies to something that a person who has a medication that gives countless reactions. So we need to know so that nothing is prescribed that could interfere with the condition we're trying to treat. So the update is extremely, extremely important. And I know it feels like sometimes like you're being interrogated. It is not an interrogation. It's 20 questions, but asking the right 20 questions to ensure that you're getting the treatment that you need most. And the other thing that I think a lot of pharmacies are doing now, especially at our pharmacy, is to give a delay in terms of the timing for the preparation, because we're all very busy people and everybody understands that. But if we provide you with a delay, it's so that you can organize what you need to do in your day, that you understand that it's going to take a lot of time to do the preparation or less time depending on what it is. So we're keeping you informed, and it's a conversation to ensure that we provide the service you need and you get the information necessary and you know how to organize what you need to do while you're waiting for your medication. So that's the first step. When you move forward to the second step, what happens once the prescription's out of your hands and the technician has it in their hands? Well, there's a whole another series of steps that maybe you don't get to see because you're sitting down in the waiting room. Step 2 involves the pharmacy technician taking the prescription. It might be the one who took it from you or another technician who's taking over. And the prescription has to be entered in the actual file. So that involves making sure we're entering the right information, the right way to take the medication. We're checking the information. Once again, it's a double verification. Do we have the right name of the patient on the prescription? Are we entering in the right file, the right date of birth? A lot of things go into play to put it in. And then once everything is entered in, the manual part of it is printing out the labels, the receipts, the information sheets that go for the medication. And then we move on to another step, which is the counting of the medication. So the medication is counted according to what was entered in, and everything is put into a basket with the prescription, which is handed on to the next step with the pharmacist, who has a bigger job of verification to do. So we're not just pill counters. There's pill counting, but there's so much that is involved in the actual counting of the medication. When we take a bottle off the shelf to count your medication, we're not just randomly counting and making sure this is the right one, we're counting it. We're looking at the expiry date on the bottle. Are we checking for whatever reason if it's not available? Do we have to order it from another company? Is there a problem with the company that we should know about? If there was an issue, they recall the product, we have to find alternatives. There is a whole series of questions that go into place in step 2. So it's not just the enter prescription count, it's enter prescription, validate all the steps necessary, count if we have the required medication on hand, and then we can pass everything to the pharmacist. So step 3 with the pharmacist is a lot more elaborate. And this is, I think, something people need to take into account when they go to the pharmacy. It's not a question of, I come for my medication, the pharmacist will check the prescription, I get my medication, it's done. There is a whole series of questions that have to be answered by the pharmacist before the medication can be given in your hands. And it's some very important questions if you think about it. So a lot goes into the verification. Notably, first of all, is the prescription complete? We need prescriptions that are properly written by healthcare professionals that are authorized to prescribe the medication that's on the prescription. So there's one verification for that. Then there's a question of prescribing the right treatment for the condition that we're looking at. If we asked you at the beginning when you gave the prescription, why was this prescribed for you? There's a reason, because sometimes the treatment is not the most appropriate treatment for what you're being prescribed. So you need to have the right option for it. And that is another question that needs to be asked when we know why you're taking the medication. The other question that comes up is it the appropriate treatment at the right dose for the patient? Sometimes the doctor might not be certain, or the prescribing person might not be certain. So what do? They put whatever dose they think it's supposed to be. And let's say the patient is an elderly patient with kidney problems and the dose needs to be adjusted. So it's not the right dose for their kidney function. So things have to be changed in terms of the prescription. So the pharmacist is also doing a whole series of calculations. And notably, sometimes we ask the question when you show up with the prescription, could we have your height and your weight? And there's a reason for it. And we're not judging you because of your height and your weight. There's no judgment on it at all. It has to do with the calculation that needs to be done later on for the medication to ensure we're giving you the right dose. So pharmacist is doing adjustments if needed. And if something comes up that doesn't make sense, there's another step added where we have to contact the actual person doing the prescribing of the medication, whether it's a doctor, a nurse clinician, a podiatrist, an optometrist, whoever has done the prescription. If we need to contact them, that factors into the next level of verification if something's wrong. So that adds to the timing if you think about it. If there's anything else particular about the medication that's being prescribed, we evaluate that in terms of the information. So we look at the notes that we might have regarding the medication. Is there something in terms of its use with something you're taking already? So we have to look at the interactions. Is there something that you're taking over the counter that might be a problem for what you're taking? And this was only mentioned when you mentioned it today, but we never had that in your file before. So an added level of verification goes there. And of course, notably, is there a possibility of an allergic reaction? So sometimes it's not the same medication, but there could be a cross reaction where you still could be allergic to the medication. So this is a whole series of boxes to be ticked off while the prescription is actually being evaluated by the pharmacist. So it's a lot of work when you think about it. It's not just, here's the medication, are we giving the right thing? There's a lot that goes into it for the actual process. And only once the prescription is properly assessed and verified, we move on to the next step. And the next step is the pharmacist verifying the medication. So we have the medication counted in the basket. And what do we need to check there as well? Of course, there was a label. Of course, there was an information sheet. Of course, there's a receipt. But have we done it in the right file? Do I have the right patient's name on the label? Am I looking at the right medication? There's an actual visual verification of the pills in the actual container. So are we giving the right dose, the right pill according to what it should be according to the label? And of course, the right quantity. Sometimes the quantity is incorrectly counted or it's the wrong amount for the duration of the treatment. So that also goes into the play of like verifying what happens with the medication before we give it to you. So another level. So all this is happening while the pharmacist is at one particular station looking at the prescription and doing stuff while you are sitting there watching them in the waiting room. What comes next? Obviously, once we've checked off all the boxes in terms of the preparation, is everything good? Are we sure that the treatment's appropriate? The pharmacist will call you for the consultation. So the consultation is the definitive moment to ask the questions you need to ask when you need to know, what do I do with the medication? The pharmacist in general will give you the information on how to take the medication, explain why it's being prescribed for you, will tell you about possible side effects. And to be really honest, there's a list of them on the information sheet that's provided, but it doesn't mean you'll have all of them. But it's kind of important that we do tell you that it could happen, the most common ones at least. And at that point, the pharmacist can also ask you, do you want us to follow up with you? We can actually check if the treatment's working well or not. If there are problems with it, you are always welcome to call and come back and discuss. And if you have any specific questions, because it's a new medication you've never taken before, it's a little daunting to be able to be forced to take it at this point, you can ask the question at that point. And there's no stupid question. You really should ask whatever you think you're not sure about. And if you're unsure, don't ever hesitate to call back or check again if you're uncertain about what was heard when you were getting the consultation. And finally, once we get to that step, obviously you're paying for the medication and you're taking it home with you. And then it's on you to take the medication and the follow-up can happen. But so that was just the protocol for what you do for giving a new prescription in and how it's served. But there's so much more that's taking place while that one circuit is happening. So as I said before, sometimes you show up and you see 5 people behind the counter and you're wondering, what is going on with the 5 people behind the counter? Why are there so many people in the waiting room, so many people behind the counter, and it's taking forever? Well, while you're giving that one prescription, at the same time, consequently, at the same time, you have other people that have done orders by telephone, they've done orders online, there's doing a preparation of medications and what we call the blister packs. So blister packs to help you better take medications when you have a whole series of them. So what you're looking in the bottom right-hand corner that says Dispill, that is a blister pack for a patient who has a considerable amount of medications, and they're organized by date and moment that you have to take it during the day, morning, noon, evening, and at bedtime. So just to help them better take the medication. So that's being prepared simultaneously. And then you see people on the phone. What are they doing? They're not just having conversations. They're handling insurance problems. They're booking appointments for vaccinations. They're checking things that need to be done for blood glucose tests. And there's always someone entering new prescriptions, which, to be really honest, since the pandemic, I think we have been considerably overwhelmed with prescriptions by fax. Maybe we get 50 to 100 prescriptions, and sometimes it's just a battle to try to get through entering all of them, but there's a time delay for us, so we have to enter them as soon as possible. So we're doing all these different steps simultaneously while we're taking in new prescriptions from patients who are showing up on site. And as you can see, I put this under the pharmacy technician. So they are doing a considerable amount of the work, as I mentioned earlier. They are literally the backbone of some of the activities that are happening. So they're handling a lot of stuff so that on the other end, when the pharmacist is doing the verification, he or she has everything in place to properly to answer those bigger questions in terms of the doses, the interactions, and everything else, because they are first and foremost the experts in medication, how they're supposed to be used. What about on the pharmacist end? So I mentioned the flow, the circuit of the medications from beginning to end. So while the pharmacist is doing that new prescription for you, what is he or she doing before you showed up with that new prescription? Well, there are multiple calls on telephone from consultations with patients. Maybe a doctor's calling in a prescription by phone. Maybe someone needs some information and management, some information, some follow-ups that need to be done for their medical condition. Or someone's calling because they want to take a medication, they have a cold or the flu and they're not feeling so great, and they take medications regularly for blood pressure or some other reason, but at the same time they're like, can I take this Tylenol cold and sinus? Or is it good or is it not good for me to take? Is it a bad idea for me to take it long term? Can I share it with my spouse or friend who's not the same age or the same weight? So many questions are being asked at the same time. And ultimately, if it's not regarding patients on site who are patients from the pharmacy, people do show up as well who are not patients of the pharmacy, and they ask similar questions as well. But that involves also knowing, what are they taking in other pharmacies? Do we know if they're taking anything that involves a deeper evaluation of their file? And that might not be something we can access quickly, because we have to be able to know what they're taking in other locations. And of course, if something serious comes up, then of course we could be asking the patient, maybe you need to go see a doctor for that, or there's something wrong, the doctor's not accessible, maybe you need to see an optometrist, let's say, or the problem is foot related, maybe you can see the podiatrist. So there are multiple options that you can look at for help, better finding a way to look after your health, but that involves thinking that there's someone giving you this consultation, but there's plenty of other things happening in the background. And of course, minus the fact that we're doing all this stuff, the pharmacists are also doing the verification of prescription orders at the same time. So those people who are calling in those prescriptions or saying, oh, I'll pass by tomorrow and pick up my medication as usual, that has to be verified as well. The content in the bottle, are we giving it to the right patient? So there's always a double verification. And as I mentioned earlier, those blister packs, there are a considerable number of elderly patients who use that for the preparation of their medication. So we don't prepare them last minute, they're prepared way in advance. So there is a continual flow of verification of those medications. So that is all happening in the background while you show up to pick up a new prescription. So why are we talking about this? What has changed in the last few years when it comes to working in a community pharmacy? Well, I think we need to look at the scope that's changed in terms of the practice. So many things have been improved over the years, and we could start first and foremost maybe with the pharmacy technicians that I mentioned earlier. So some pharmacy technicians do their training, and it's a CEGEP training, and they're able to work in a pharmacy so they can do the basic things I mentioned, but maybe on the actual job market, they're able to learn some of the things that are done clinically. But now we also have technicians, as I mentioned, in a new program. And these technicians do even more work than was previously done by the pharmacy technicians in the past. So what can they do to help you? Let's suppose you're a diabetic patient and you have to check your blood glucose levels. And you're not sure how to use the machine because it was very complicated when they gave you the machine at the hospital. What can a pharmacy technician do to help you? They can sit down with you with the machine. They can actually do the blood glucose test with you. They can evaluate if you're doing it correctly and watch you while you do it. They can actually measure your blood pressure if there's a problem. So that can be done with an automatic machine. Most pharmacies have an automatic one that's available in the waiting room, so they could show you how you can measure it yourself. And they can give you information about how you can note it down. What are the type of requirements you need to do? You need to take it maybe same time every day. Have you done certain steps? Are you writing it down? Are you taking the blood pressure before or after taking a medication dose? A lot goes into play. And some people have medication for blood clotting or to thin out the blood a bit. So certain tests are required, the INR test. And sometimes if it's a question of someone being sick and maybe they have a sore throat, most pharmacies, if they don't have a nurse, they might have pharmacists or technicians who can do the strep tests. So they can actually do a culture in the throat to double check if you actually have streptococcus, so if you actually have an infection. And certain conditions allow the pharmacist to prescribe antibiotics. So now here you are getting treatment without actually passing to see a doctor or a nurse clinician, all at your community pharmacy, which is conveniently located nearby. And of course, as we mentioned before, since the pandemic, but even before, vaccinations have been kind of a priority for pharmacies. So we've increased the amount of vaccinations that are available to patients. So now pharmacists, not just the nurses, but the pharmacists and their technicians are being trained to actually vaccinate patients. And we're not talking about just COVID shots or flu vaccines. We're talking about other vaccinations that you might need for shingles, pneumococcal pneumonia. Is there a specific series of vaccinations you need for a trip that you're taking? That might require something, but that can all be done given the certain age of the patient in the pharmacy with an appointment. And here in Quebec, we do everything through Click Santé. So our online vaccination portal where you can book appointments and you can select the pharmacy of your choice that's nearby and book those vaccinations for what you need. And of course, at the very end, like I said, the technicians are being trained for more clinical activities. They're integrally involved in helping the pharmacist better assess what type of conditions can be treated in the pharmacy without seeing another healthcare professional. So now we're talking about certain conditions that doesn't require a doctor to look at you, but the pharmacist can assess it. So in this case, the technician can actually speak to the patient, take down the required information, enter a prescription that can be validated by the pharmacist and be served by the pharmacist under their license. So this is a big step from struggling to find a doctor to getting treatment when you absolutely need it. How does this work on the pharmacist end? Well, as I said, the scope is expanding for them as well. I mentioned earlier there are minor ailments that pharmacists can actually help you with. So you might show up in a pharmacy, and I have to admit that part of this is still regulated under certain rules. So yes, they can prescribe for certain conditions, but the conditions have to be with certain criteria. You might have had to have a prescription in the past 5 years from a prescriber who's a doctor or nurse clinician in the past before the pharmacist can actually give you the medication, just to know that you have actually been diagnosed with the condition previously. This is not a de novo condition that you've never had before, and no medical professional has checked this on you before. So ideally, if you've had prescriptions in the past from doctors for certain conditions, sometimes the pharmacist can actually prescribe them again for you. So we're talking for things like cold sores if it comes up, if you have allergic rhinitis, if you have eczema on your skin, hemorrhoids. And for women, sometimes with a urinary tract infection, it's very difficult to get an appointment with a doctor. But should you have a prescription from a doctor in the last 5 years, a pharmacist can actually re-prescribe a treatment for you so that you do not have to go take an appointment with the doctor that might be very hard to reach. On the other hand, if it's not a minor ailment, there are certain conditions that can also be prescribed without a previous condition, but given the situation, a pharmacist can evaluate a patient and be able to prescribe certain medications. So obviously, one of the bigger ones is that people come in and they want to stop smoking. So pharmacists are well positioned to give you the right types of treatments, can evaluate what worked in the past or didn't work in the past, and actually prescribe the treatment that might help you better be able to stop smoking. Let's suppose you just recently found out you were pregnant. Prenatal vitamins are highly recommended. So let's suppose you don't have an appointment with the doctor right away. You're still waiting on that. The pharmacist can provide you with a prescription for the vitamins that you can take in the meantime while you're waiting. Should you have nausea and vomiting, and this could be for whatever reason, a pharmacist could prescribe something like Gravol for you if you needed help with that. And it could be related to any specific condition, but they would be able to give you something to help you and alleviate those symptoms. And maybe one of the bigger ones that I think people are taking advantage of a lot more often. I'm sure a lot of you have seen the commercials on TV from Uniprix or a lot of other different pharmacies out here in Quebec that let's suppose you want to go on vacation and you want to have your travel kit with you. I love how people say this travel kit. It's not essentially a kit, but it's a medical travel kit for what you might bring with you if something comes up while you're abroad. Because obviously we know if something happens while you're traveling, you might not have access to a healthcare professional. It might be very expensive, might be very difficult, might not know what type of medication is recommended for you given it's a foreign country. Travel health is becoming more and more a bigger service that we're offering. So with the right delay of time, if you see the pharmacy well before the day you're leaving, not at the last minute, a pharmacist can look into your file and decide what you might need. Should it be medication for maybe nausea or something that happens while you're abroad? So Gravol could be prescribed. If you have traveler's diarrhea, they could prescribe an antibiotic if there's something more severe that might happen to you given the location you're going to. They could prescribe Imodium if you have just regular diarrhea that requires some sort of treatment. Some rehydration solutions like Pedialyte or Hydrolyte that could help you in case you have a loss of fluids, and even go even further for medications to help you if there's an area that might have malaria. They could prescribe the medications needed for that. If there's you're going to high altitudes, the medication you might need for those high altitudes where you're traveling. So there's a whole series of things that could be given, and that involves properly assessing your file, but coming well in advance. But a pharmacist would be able to look into that for you, and with his or her team be able to give you the doses necessary for your trip. On the other end of types of things that the pharmacist can do in terms of expanding the scope of the practice, I had mentioned earlier the chronic disease management. So I'm sure sometimes you get diagnosed with a condition and Let's suppose it's a specific doctor at the hospital. Maybe they'll see you in 6 months. And in that 6 month time, you have medications to take that you've never taken before. And now you're not sure what you're supposed to do. Well, a pharmacist and the team can be there to help you. So this is the management of the condition. They could look into you in terms of how's it going with the first dose of a medication, if there are steps to be taken, scheduling a follow-up appointment so that they can discuss with you, how are things going with step one? Have you had side effects? Is it going well? If it's not going well, should we see if we continue with step one? If you're not feeling it's effective enough, can we adjust the dose to the next level? Or we move to the next step because the first step was just not good enough, not very effective enough in treating the condition. So it's an ongoing communication and discussion with your pharmacist. And should something bigger come up, the pharmacist and the team can communicate directly with the prescribing person. So the doctor, the nurse clinician, whoever gave the original prescription, to communicate that this is what's being done in the pharmacy. This is what we're doing to make things better. And this is what we think would be better long-term for the patient. So it's an ongoing discussion to better help you. The other thing that pharmacists are doing extensively as well is doing a lot of the teaching required or the training required for new medications. And I think this is becoming more a bigger issue when we're looking at injectable medications. People don't often have prescriptions where they have to inject something, but when they do, it does involve a little more time for the preparation and to better be able to teach you how to use it. So let's suppose you're diabetic and they've decided they were going to add an insulin to your medication. There's a lot that's involved in it. There are needles, there are the specific pens for the injection. There's how do you adjust the dose when you need to? Where do you do the injection? How do you prep for the injection? A lot goes into place for the preparation for the medication and how you can use it. And it could be a really long discussion in terms of you understanding what you need to do, how to do it yourself. And it might be daunting and very difficult at the beginning, but that's where the team is in place to help you better be able to do the steps necessary. And as I mentioned earlier, it always goes back to if you have questions, you can ask, and the team will be there to assist you if you need to do something more, or you just don't understand how it needs to be done, and you want to better understand to be able to control the situation better for you. There are other services as well that can be offered. I think I mentioned a few of them earlier. So the picture on the far left of your screen is the blister packs that I was mentioning earlier. I know with the aging population that we have here in Canada and Quebec, it becomes increasingly hard to manage medications, especially if there are multiple chronic conditions at the same time. So these type of preparations are something that most pharmacies offer. There's no additional charge in preparing it at all. It's just properly prepared for you, as I said, with the dates, with the moment of the day that you need to take the medication. So if you have a series of pills that are only in the morning or a series of pills that you take 3 times a day, it's all arranged for you. So you just open the little square of the date and you're able to take the dose without thinking about, did I take my dose? Did I take it at the right date? Did I take it at the right time? It takes the guesswork out of using the medication. I think that's the important thing about it. So that's one of the services that are offered at most pharmacies. And it's very beneficial for patients, especially if they're struggling with their medication. And it's not to say that they're losing their ability or their independence to take their medication, but it ensures that you're better able to take it. And it allows us to better help you be able to take your medication as well. And I think follow-up wise as well, we can be certain that you're very observant in the medications, you're taking them as needed, and we could check with what you've been using at home. The other services you might be able to get when you go to a pharmacy include the disposal of injectable material that you might use at home, like the insulins that we mentioned earlier. Generally speaking, when you first get a medication that has is an injectable type of medication, they will give you offhand the actual yellow biohazard sharp box. But if for whatever reason you don't get one, you should be able to pick up one at any pharmacy. And when it's completely full, you can return one to our pharmacy, and the pharmacies are obligated to take them in and do the proper destruction of the actual item. And should you have expired medications as well? And I think we all tend to leave this on the wayside sometimes, but when you accumulate medications at home, once in a while, you should take a look at the expiry date. You can also return these medications to a pharmacy. They do not go in the garbage. You don't flush them down the toilet. You should obviously take them out of their packaging, put them all in a little bag, like a Ziploc bag, bring them to the pharmacy, and there are specific drop-off sites for it. You can dispose of them in a very secure way. We don't want this going into the environment. We don't want someone having access to medication that was prescribed from some whatever reason. So it's a secure way of dealing with expired medication. You bring them back to the pharmacy for disposal. And finally, in terms of something that maybe first responders or certain healthcare professionals might need and they can get from a pharmacy is sometimes people are prescribed medications that are opioids for pain, or there are people who are exposed to taking opioids. And should there be an overdose, at any given time, you can go to a pharmacy and free of charge, you can pick up a naloxone Narcan kit. It's to help a patient who's having an overdose, and administering this could actually save their life. It could happen without even anyone realizing, a child getting access to the medication in a home. So having one around free of charge in your home is something that a pharmacy can give you, and it's a way to ensure that you could protect other people, if not for yourself, but for those around you. Finally, I think I wanted to talk about something a little more, maybe in terms of the etiquette aspect of coming to a pharmacy. I'd mentioned a little bit of the situations earlier on when we were discussing the flow of how things work in a pharmacy. So I think we need to remember, as I said, a lot of things are going on behind the scenes. So let's think about, excuse me, let's think about what you need to be like when you're at the pharmacy if you show up in person. So I think in any given situation, in any healthcare setting, in any customer service situation, you have to respect the team. You have to respect the people ahead of you who are being served. I know people are very busy. They're always in a rush and they tap their feet. They're banging on the counter waiting to be served, or they're like huffing in the background because it's taking forever with the patient in front of them. We really, really, really need to be more empathetic to the fact that everyone is working really hard to help you. And some people are coming to the pharmacy and they've just had major surgery. They're feeling extremely unwell, and there's no one that can accompany them. And they have to bring that prescription in to be served. So everyone deserves to have the time they need to ask the appropriate questions and be served accordingly. So I think respecting the team that's doing the work and the patients ahead of you is also a really, really important thing to think about. A corollary to that is, of course, the timing, right? We need the time to actually prepare things. So if you want your medication prepared appropriately and the orders to be prepared correctly, we have to remember at the end of the day, dispensing medications is not the same thing as serving fast food. And I can't explain to you how many times I think we have said this phrase out loud at work. It is not fast food. If you want to get the right medication for the right reason, for the right person, we can't be rushing to prepare things. And it's not a question about putting a label on a box that you take every month and giving it to you at the cash, because you know full well errors can happen, right? And now that you know what happens behind the scenes, there is so much going on. It's not 2 seconds for us to do that step. It's a solid 15 to 20 minutes or more, depending on the circumstance. So please remember that we are not serving McDonald's. We're serving the medication that could save your life. What about time constraints? Everybody shows up, like I said, busy. So if you have time constraints, why don't you do the options that are helpful to you and to us? Find out what can be beneficial for you so you don't have to sit there waiting for things. A lot of pharmacies have services that are very, very, very helpful to you, such as pre-authorized refills. So every month, every 30 days, the pharmacy automatically prepares the medications that you need for the month, and then they call you when it's ready. That saves you time, saves them time. You can do renewals via a telephone system with your pharmacy, depending if they have it or not, or you can have a code to do renewals online. And doing it online is great because I think it also offers you the timing of when it'll be prepared. It'll tell you what specific time you can pick it up. So depending on the actual system, you'll have access to it, and it saves you time when you think about it. What about being responsible for your prescriptions? Now, no one's going to monitor you considerably about what you need to do in terms of your prescriptions. Obviously, the pharmacy sometimes calls to see how it's going when they're doing follow-ups. But if you're the type of person who doesn't really pay attention when they have to renew their medication or does not take advantage of the systems and services that are available, you got to think about renewing your medication appropriately. If you wait too long, your prescription could expire. If you don't renew it at the specific date and it's months since you last took it, it raises questions when the team looks at your file to renew stuff. They will ask you the appropriate questions. We're not there to mother and monitor what's happening all the time, but please be aware if we're asking you the questions is because you have a responsibility for your health. So if you don't have any refills, if you need to see your doctor and it's been months since you last saw them and you want to renew a prescription that you haven't taken for the last 12 months, we're going to ask you questions. And it's kind of your responsibility as well. It's your health. We're helping you put your health in your own hands and be able to handle things better on your end. We are there to help in whatever way possible, but you need to be responsible as well. Finally, as I mentioned earlier, and Melissa had mentioned as well, we were talking that this month is Pharmacy Appreciation Month. And you know what? It's very important to think about all the different things that your pharmacy can offer you. So why don't you think about the next time when you're in a pharmacy, just giving a simple gesture of how much you appreciate the team that's working hard for you, especially if you go regularly every month for things, or if you go for vaccinations. We are working really, really hard. And given the very difficult context of our healthcare system here in Quebec, sometimes people don't even have family doctors to go see. So your pharmacist and the pharmacy team are readily available to you. Please appreciate that they're doing everything they can for you. And they have the resources and they have the skills and they have the information that could better help you when you're really, really stuck. So please don't hesitate to call. Please don't hesitate to come see us. And like I said, with all the information, I can be respectful of what we're doing behind the scenes. I know that we're there whenever you do need something. And that would be the end of this presentation. It's been really great being able to talk to you guys about this. I really appreciate everyone listening in. And I will now be ready to take any questions if you have any.
Thank you so much, Priscilla, for that very helpful and informative presentation. So we'll open the floor up to any questions you might have. So you can just unmute yourself, or you can even write questions in the chat.
Well done, Priscilla.
Thank you.
It is hard work, that is for sure. And I'm amazed. I mean, 15 years you've been at it. Hats off to you. It's a very demanding and exigeant
And it is,
travail.
I think people have forgot when we had the pandemic, when it started in 2020, it was everything shut down and a lot of people went to work from home. We were consistently open. We had to physically be present in pharmacies. We had the masks, the visors, the gloves. We were handling a difficult situation. We were monitoring people. It was a lot of work. And I think a lot of people burn out from that type of situation.
Mhm.
But we were there on the forefront. It was complex, but everyone's health was important and hospitals were overwhelmed. So we became the backup situation for people to come see someone for help.
Yeah. And just going to the pharmacist sometimes, even though it relieves some concern you may have in you know, in your mind, whether it's real or not, it doesn't matter. It's a concern that you have to address with the client when they come in. It's true, whatever it is. But yeah, high stress for sure.
Yeah, and also like we appreciate now, like, hearing all this, like besides having the technical knowledge of being a pharmacist, like having those people skills as well to deal with uh, all kinds of people that you'll see on a daily basis and dealing with their tantrums and mood, like, their attitudes and all that takes a lot.
It is.
And always having a like that smiling face while
Yeah, you
speaking to
got to
them.
try. I think I've told people in the past, they've wondered, how can you keep a smile on your face when everything is going downhill around you?
Yeah,
And the answer to that question is because people are already coming to you not well. You
yeah.
can't add to that feeling of unwell for
Mm,
them. You have to bring them up somehow. And we get very lucky enough that not everybody who comes to see us is
mm,
unwell. Some people come and they actually just come to say hello. And they
yeah,
smile and they say, have a great day. And there was nothing we had to give them at all. So they're
yeah.
appreciative in that way. And it goes a long way in increasing the mood for the
Mm,
entire team.
yeah. How did you get into pharmacy,
Um,
Priscilla?
well, I think it was more, I had friends who went into it and
Mm,
they were telling me about it. And I'd worked in pharmacology related stuff during my master's. So there was work that we had done in terms of medications and how it works.
mm,
And although research was fun, I think I missed the physical contact with people. So the actual community pharmacy is very somewhat different from the hospital or the
mm,
research industry aspect to it because it involves more people skills. It involves more customer service. So if you're a people person, it's a
mm,
lot more fun to do. And you can see the physical like improvement on people's faces when
mm,
things are going well. They appreciate you, they say so. They're able to come see you and it's rewarding. It's absolutely rewarding for someone to say, thank you so much for making my life better. I was struggling and now I know how to do things better for my own health and I can manage. And that's all they want. They just want to be able to manage properly.
yeah, yeah. And how does it work with like prescription renewals? I know sometimes when I go for my regular medication, they say, oh, you have only 1 month left, you need to see your doctor. How does it work with that?
I'm very glad you asked that question because I didn't mention it in
Mm,
the presentation, but
mm,
one of the increasing acts that pharmacists can do now is that we know full well that accessibility to a family doctor or your
mm,
prescribing physician is very, very difficult. So what
yeah.
happens now is that pharmacists, given the type of prescription, can extend your prescription until you're able to get an appointment. So it's very old school to send faxes to doctors unless it's
Mm,
absolutely requested by the clinic or the hospital. As
mm,
much as possible, what happens is that we'll ask you, when did you last see your doctor? Do you have a yearly follow-up? If you do, when is the next follow-up? And then what we can do, given the original prescription, let's say your original prescription had 12 renewals, we
mm,
can extend up to a maximum of 12 renewals given the type of medication. So you don't have to stress about not getting the medication. We won't leave you without the medication, but you need to do the steps within the time frame we give you when we extend the prescription. So we only warn you because a lot of people, as I said, are not on top of their game when it comes to their medication. They won't realize they're at zero, and it clearly will say zero on the actual label. And they'll say,
mm,
"You never told me." Well, I mean, you have to look at what you're taking sometimes. It says zero means you
yeah.
don't have any. So you do the steps in your area, but we do have measures in place to help you. So
Mm,
prescriptions can be extended, and in certain circumstances, we will send the fax if the clinic or the hospital requires it. Especially if
mm,
the doctor is, let's say, on maternity leave, and there's another doctor who's taking over the file in the meantime, or you've lost your family physician and the doctor who's taking over the files needs the prescriptions, we will send the request directly by fax.
okay. And with the insurance company, because I know sometimes they say, okay, your insurance will only allow for 3 months or whatever.
That's a different thing.
Mm,
I think the insurance companies it's a whole different aspect. Some people go on vacation. I'll give an
mm,
example for the snowbirds. They leave on vacation and they want 6 months. So
mm,
yes, you can give a supply of 6 months to a patient. The problem with that is if you have a private insurance,
yeah.
sometimes they cap it at 90 days. So what you
Okay.
need to do on your end, it's not really
Mm,
the pharmacist's job to call your insurance and
yeah.
ask them, can you extend the coverage for 6 months? What the patient should be doing, knowing full well they're leaving on vacation, is to call the insurance company, say, I need a supply for 6 months. Can you authorize it with the code? If it can't be authorized, they should know that they can have 3 months covered, then they'll have to pay the remaining three and they'll have to claim it manually. But there are always
Okay.
alternatives. But I was going to say the insurance aspect
Mm,
is really like it's a puzzle sometimes. We're telling the insurance company it's not working. They're saying it's our fault. We're saying it's not our
mm,
fault. It's your fault. It's not working. So every single time the patient gets stuck in the middle. And the important thing is that it remains the patient's medication. It is the patient's insurance. They should understand how it works and what is
yeah.
covered when they come into the pharmacy.
Mm. Thank you.
No problem.
Thank you, Priscilla.
You're
I have
welcome.
a
Thanks,
question.
Priscilla. Yeah.
Very recently, I mean, it's been at least 6 months now where we have lost a family doctor because he retired.
Mhm,
So in the meantime, I'm stuck. Like I really need to do my blood work.
mhm.
How can I do? Do I just go to the clinic, walk-in clinic, and get the doctor
Y-
to?
You can. I think I might give the information if Melissa wants to post it later on. How it works in Quebec is that we have the system called a YAP. So it's basically if you contact them with the government, the Quebec government has this in place for healthcare professionals. You can have access to find an appointment in not pharmacy, a clinic nearby with a doctor if it's an urgent situation that can help you. But alternatively, if it's, let's say, I'll give you a good example that we do all the time. A patient might have a thyroid problem and is on medication for their thyroid, but that requires continuous blood tests. Now you don't have a family doctor anymore. Now you don't have a requisition for the blood tests. So what do? You can see your pharmacist, and the pharmacist will be, okay, well, in that case, I can prescribe you the blood test because the pharmacist can prescribe any sort of blood requisition relative to the medication you're taking and only the medication you're taking. It can't be for something outside of it. It can't be something you're not taking and you want to know can you do a blood test for that? So let's say the pharmacist will be, okay, I'll prescribe you the blood test so we can check your thyroid hormone levels. And you can take that prescription to the CLSC, whichever place does blood tests, and the information will be faxed or given back to the pharmacy. And the pharmacist can make a decision to extend your prescription or tell you I need to adjust the dose because it's not the right dose for you. So the pharmacist can really do the clinical aspect for you. They will take over the job that the doctor or the prescribing physician would have done.
Oh, okay. So the pharmacist can do the prescription for the
They
blood
can
test
do it. They
or the
can do it.
medication that we are taking
Exactly. Like I said, it has to
until
be
we get the
medication
doctor.
that medication that you already have in your file that you're
Okay.
taking regularly. Blood tests or whatever requisitions are needed for those medications can be prescribed by a pharmacist.
Yeah, that's good to know,
Mhm.
because really this information that you have given has, like, furthered our knowledge of the pharmacy aspect, and also a happy appreciation month.
Yes.
You got to deliver your clinic in a month.
I know, I know. I said the same
Worked
thing. I'm
out.
like, I didn't even think about it. And I'm like, you know what, we should do it. And then I realized it was. And it's really important because you never realize, like I said, behind the scenes, so much is happening. And you might come in and be like, I ordered my medication, and you're at the cash picking it up, and you have no idea what 20 steps happened for it to be there. And so
Yeah.
much has happened for it to be there. And like I said, the team works extremely hard. It is a continuous team effort from A to Z. It's not one person, it's the 20 people who are working different shifts to make it happen.
Yes, we can really get mad sometimes when we are waiting in line, but
Oh, of
now that
course.
you have opened our eyes, and we will be more
Yes.
mindful.
Of course,
Yeah,
of course. And
thank
you know,
you for
it
that. And
happens.
it's really a beautiful, this, presentation. Love it.
Thank you. Thank you.
Yeah.
Well, that's the thing. No, it's when you know better, you understand, right? So, I
Mhm.
mean, I can understand, like I said, people show up and the waiting room is full. You're tired, you don't feel well, you need the medication, you have other things to do. We understand that. If we were in your place, we would understand that exact same situation, but we would want someone to take the care that we're taking for you, for us as well. So the
Yeah.
patience goes a long way, but like I said, we live in a very fast world. Patience is very hard to come by. It's a virtue that's more difficult to have, maybe.
Yeah.
Yeah. Much appreciated. Thank you.
Yes.
Some nurses are connected to the pharmacy. Like once a week, they come. Like am I right in saying that they're connected to the pharmacy?
I sorry, I didn't get
Uh,
the first part of it. What's connected to the pharmacy?
no, in our pharmacy, a nurse comes once a week.
Yes,
Uh,
yes, yes,
uh,
yes.
they, okay, so
That's true.
it's the pharmacy that arranges for them to come once a
Exactly.
week.
That's correct. That's correct. We had a nurse in our pharmacy before, but then she went on maternity leave, and we realized that the team was being the technical team, the actual technician team was more developed enough that they could handle the overflow. I mean, obviously we can't do things like ear cleaning or to check in the wax in the ears or do certain things that only the nurse could do. But I mean, in terms of vaccinations, in terms of the strep tests, these are all things that the team was more than able to be able to do. So the nurse was not necessary. But understandably, most pharmacies will have a nurse affiliated so they could have someone who could come in because I mentioned the vaccinations. Vaccinations are as of a certain age. If it's a child's vaccination and they're too young, pharmacists or the technicians can't vaccinate them. It has to go through a nurse. So there are certain conditions would require the nurse in that case.
Okay, so what else do the nurses do? I know that's not your field, but I'm just like curious. Like if I need to go for I don't know, I have the flu, I need to see it's too high, I have to go, high fever, and I have to go see the nurse. Can I do that?
Yes, you can. Actually, I was going to say certain, I think it's what they call the Groupe de Médecins de Famille. So the GMFs are involved with a lot of different healthcare professionals together. So you might have a pharmacy affiliated with a series of doctors, affiliated with nurse clinicians who are super nurses. So the super nurses can diagnose, they can prescribe, they have all the skills to do that. So they can do the overflow work that the doctors can't do. So if
Correct.
you find what they call a GMF, if you have a place that you can actually go for that, they would have the extra staff to be able to look after you.
Okay, thanks. Good to know.
Have any more questions or comments?
And Priscilla, did you say that you can do blood tests at the pharmacy as well?
That is going to depend if you have a nurse available or not. So once again, we used to have a nurse
Mm.
available at our pharmacy who could take the blood, do the blood test at the
Yeah.
pharmacy, and transport the actual samples to the hospital. But not every nurse is able to do that, or they don't always offer that service. But I know where I work in Delson, there is a clinic that is fully
Mm.
run by nurse clinicians, and they do blood
Okay.
tests and they do evaluations for patients, but it's a private clinic, so you will pay for it.
Okay. Yeah, that's what I wanted to know.
Alternatively, you could do the CLSC, but I think the CLSC
Mm.
right now it's a little trickier with their blood tests now. They've organized it by priority. If it's an urgent blood test, less urgent, and then
Yeah.
the calendar fills up very, very, very quickly.
Yeah,
If
true.
if
Yeah.
book an appointment, it's gone within the next week. So it's very, very difficult to book appointments, and that's free. So I know why people rush for that one because it doesn't cost anything. But sometimes paying the extra money guarantees that you're going to have great service. It'll be fast, and the results will be forwarded to your physician as soon as possible.
Okay. We can also go to Click Sante, right?
Absolutely.
And make appointments, right? Yeah,
Exactly.
Yeah.
I know
appointments. Yeah.
exactly. We used to have that, like I said, when you have a nurse available, you can book stuff with the nurse,
Then it's okay.
like you do vaccinations.
Are the flu shots free of charge, or you have to pay for them?
No, flu shots are always free. It's a public health situation. So Quebec offers them free of charge, and the pharmacies are one of the locations that they administer it. And they normally have a vaccination campaign. So some people ask very, very early, but I think normally end of October, November is when we start, and we were doing them well into February.
But before, I think the flu shots you had to pay. It was only available for people with problems, right?
Exactly. There was a situation where they had a certain type that you had to pay and one you didn't. Now they're, I think globally I think it was completely free. It's a question of public health now. And the flu season tends to become very intense sometimes. So I think following COVID, it was an issue of making sure people were better vaccinated and the most vulnerable people in the society don't get sick and don't get uselessly and unfortunately get sick and get very, very, very ill when they get sick.
Yeah. So yeah, so then you have to book your appointment through Click Sante and then go for your appointment. You cannot just call.
Oh no, actually, I'll give you a little handout for this. So essentially what happens is that, yes, you can go Click Sante, and we always recommend people do Click Sante if they're comfortable going online and booking the appointment. If they're not, I'm sure, I mean, if you're 85 years old and you barely use a computer, there's no issue for you to call the pharmacy and we can book it for you. We can open Click Sante on our end and actually, put the appointment in for you. So there's no fear about that. The team is there to help you if you're not able to physically do it yourself.
Yeah, it's pretty easy though. It's quite user-friendly, I find. Just that there's a waiting period of, my gosh, like sometimes, 3 weeks, a month,
I think we have a question in the chat. What vitamins can you get prescriptions for?
It depends. I was going to say the prescription situation for vitamins, it depends what it is. So certain high dose vitamins can be prescribed by a doctor and will be covered. The one I'm thinking of offhand might be the calcium and vitamin D that you might pick up for osteoporosis. It might be 500 milligrams of calcium. That one would be covered. The D tabs, which is a 10,000 unit dose of vitamin D that you take once a week, also is covered by the insurances. If you decide you want something like Centrum or over-the-counter types of vitamins, those are not generally covered. And what makes a difference, and this is something we explain often to people, is that medications have what we call a drug identification number, the DIN. When it has a DIN, generally speaking, it will be covered by insurances. If you have what they call an NPN on the label, which is a natural product number, those ones are generally not covered and they're supposed to be taxed. So if you have an NPN on the label, it's probably not covered. If you have a DIN, a DIN number, it most likely will be covered. But once again, insurances are picky. It may or may not cover. The RAMQ, if I just go with the government insurance, generally speaking, if it's in their list of medications and it's an NPN, it will be covered. If it's not in their authorized list of medications, it won't be covered.
So vitamins also can be prescribed medications?
It can be prescribed depending. Like I said, offhand, I think most doctors after a certain age will give patients the calcium and vitamin D because there's a higher level of osteoporosis. So they will get that as part of the medication they need to. So vitamins will be prescribed. And as I said, some covered, some not. Alternatively, maybe if you have certain conditions that require to have a higher dose of a certain vitamin D, because we do live further north and we have a lot less sunshine, unlike today. It might be an issue in the winter months. So that's generally prescribed as well. And most vitamin D doses tend to be covered as well because it's something that's essential for our well-being in the type of climate we live in.
Good to know.
Any more comments or questions?
None from my end. You did an excellent job, Priscilla. Very, very detailed, very, very much, very informative, and really getting us to be aware
Mhm.
because swear, mutter, and whatever else, go around the pharmacy and buy stuff that you don't need while you wait.
Oh, I know. Well, that's what I said. I was going to say, you know what, and I think that's why a lot of times we're like, we propose the delay of time for that one reason. If I tell you show up at a very busy time and I say, this is going to take an hour, that dissuades people from staying there and being upset. They'll be like, oh, I'll go for supper and I'll come back.
Yeah.
And that gives us a chance to work on stuff and gives you a chance to not be angry and come
Yeah.
back better, right?
Calling is so much easier. It
Yeah.
saves so much time. Then you're ready to pick it up. I
Well,
mean,
that's
we
it.
do that.
Use the services that are available to you at your pharmacy, because if you don't use them, you're the only one losing out. It doesn't change anything we do. It just changes how upset you are.
Can patients fax their prescription to you? Like, if you have a fax from work, can we
Okay.
send
I'm
a
glad you
fax?
asked that question. So legally speaking, a prescription must be directly received at the pharmacy
From the
from
doctor,
the
from the
clinic,
doctor.
from the
Yeah.
prescriber. You cannot send a
Mhm.
prescription from your work fax from a
Okay.
prescription is given by in hand to you. However, if that is the case and the doctor doesn't just gives you the one in hand, you'd have to bring the official one to the pharmacy.
Interesting. Mhm.
Or alternatively, I mean, if you have it in your hand, like the actual prescription that was given to you by the doctor, but you can't come to the pharmacy right away, but you're not feeling well and you think you want us to prepare it and be able to get a head start on your preparation, look into what your pharmacy offers as services, because it's not legal to send your prescription by email either. But Pharmapre, as an example, has a system online where you can send your prescription online. And what it does is that it gives you a series of questions to answer, a consent form. You take a picture of your prescription, and that prescription is faxed to us. And then you're obligated to bring the original, but because it's being faxed to us to the Pharmapre system, it's considered more legitimate than you sending it, and it's legal and it's more secure than sending it by email. So look into what is accepted by your pharmacy, but more and more now you can go online and send a prescription in advance, but look through how it's done with your particular pharmacy, because it's not just you find the email of the pharmacy owner and you send it to her. That's not how it works.
Okay, thanks. Sometimes my doctor does it directly, but in case, like,
We
if he
highly
doesn't, usually he does,
recommend that. If you can
Yeah,
tell
he
the
does it
doctor,
directly.
if you're in front of the doctor and the doctor has a great computer system that allows for it, have them send it
Yeah.
directly. That's the fastest thing for you, the fastest thing for them, and ensures you get the prescription where it needs to go at the right place. Just make sure that they're sending it to the right pharmacy, because that also is a
Right,
mistake that happens as well. They send it to the wrong one.
Yeah, okay.
I guess that's it.
Yeah.
Yeah, so if there are no more questions,
Thank you.
I would like to thank everyone for joining in. Also, I thank you, Priscilla, for giving us such beneficial information. Hope every one of us benefited from it. And Melissa for moderating as always. And now you've become an expert at moderation. Thank you, everyone. And also a reminder that our AGM is happening on the 29th of March. It starts from 2 to 4. So I hope all of y'all can join us at the AGM, and hope to see you there. And thank you once again, everybody. Bye-bye.
Thank you.
Bye.
Bye-bye.
Thank you.
Bye.
Before we
Bye.
log
Bye.
off, can we
Thank
just take a
you.
picture of
Oh
everyone?
yeah,
Bye.
take a picture.
Okay.
Take a group picture.
How are you going to take?
She's going to take Priscilla, Melissa.
Okay.
Everybody,
Give me 2 seconds.
turn on your camera, please.
So 1, 2, 3, everyone smile. Okay, let me just check to see if it came out okay. Yeah,
It's
it
good.
looks really
It's
good.
really nice.
Thank you.
Perfect.
Thank
Thank
you.
you so much,
Bye.
Have a good
everyone. Have a great
afternoon and good
day.
weekend.
Day.
Bye.
Thank
Have a
you.
good weekend. Bye-bye.
Thank you.